Vastest part, I won't get that.
It's vast.
The vast, yeah,
Oh,
like
yeah.
Especially mine.
yes. he has a vastest.
He
has a vastest
vastest media.
All right, El Presidente.
Oh.
Calm down.
Vastus vastoralis. Okay. All right, let's do this side, and then I'm going to show you on the inner thigh. I'll do that over there. How about that?
Yep.
Would you mind just keep an eye on that for me?
Yes, of course.
Good. Sorry. Okay. Let's start right over here. Lift your leg a tiny bit. Right teardrop. VMO. The only issue is here is how are we going to do VMO without hitting that like saphenous nerve and artery and vein that run in there, right? Let's see if we can get a pulse. Oh yeah, we can.
So easy.
This guy has great pulse, so you probably have cardiomegaly. That's a joke. Right? It's not cardiomegaly. So in his case, it's going to be easier because there's tons of territory there. For rectus, that's a cakewalk. Move your hand. Show me your ASAS there. So rectus femoris, right? That's a cakewalk because you can pretty much just draw imaginary line. You can also have the patient like lift up your knee a little bit.
Lift up my knee like that.
Sorry, your foot. Lift up your foot a little bit, and then down. Lift it up a little bit, and then down. Cool. Lift it up again. Where's vastus lateralis live? On the outside. Vastus lateralis, vastus medialis, obliquus, rectus femoris. And if we needle any of these, especially these two, if we needle them down to the femur, we're going to hit the intermedius, right? Vastus intermedius or whatever. So we have 3 spots here. I would say we're going to needle pretty medially. That way we're not coming down into arteries, veins, and stuff like that. Rectus, you can poke around for trigger points wherever you want to. We're going to get rectus and vastus intermedius. And then on the lateral thigh here, we're going to get IT band first, which is pretty innervated, like pretty nervy, and patients can have pain there and stuff like that. So this is a 3-for-1, right? You get an IT band, vastus lateralis, and then probably if you go deep enough, some intermedius. Depends on how. Here, maybe not so much the intermedius, but here, yeah, probably so. You know what I mean? Mm-hmm. So this is a 1, 2, 3 sticks, okay? We're also gonna look at, I have occasionally needled anterior tib for shin splints, for pain. Okay.
You need my sock off or is it okay?
You good. You guys have to recognize that this is a 2-dimensional drawing of 3-dimensional leg, because there's muscles that live on top of this fibula, right? La la la, right? And then we got like some tendon there.
Draw a smiley face. That's not. Wow, that really was more detailed than I thought it was going to be.
I like it Picasso.
Okay.
Oh, wait, that looks so good. Let me
He has a
get
necktie.
a close up.
He has a necktie. That's the
Wow.
tendon.
That's great.
What else?
I'm never washing it off. It's a piece of art.
You definitely should. If you're interested, you can palpate the joint line. Yes, arms. This keeps getting better. He's like this.
Oh, wait.
Steve, you need to trademark this before somebody else.
Put a little T in there.
Yeah, it's Titanic.
Trademark. Stephen Ford.
That's Titanic.
Yeah.
Too much.
No, at the front.
That's my
Oh, at the front.
Of the boat.
Oh, it's a girl.
Yeah.
Ask him.
Have you not seen Titanic? What is going on?
Yeah,
It's
yeah,
more like
yeah.
Leo. would
So I
say
have to
more
draw
like Leo.
Leo's face like here, and then
Yeah,
arms coming
exactly.
around. Okay, that's fine. Next time.
Okay.
When we have
I'm
time.
flying, Jeff.
Pull your foot up. La la la. Right. Tibialis anterior. Right. So this is one where you can needle anterior tib. Sometimes, sometimes in chronic severe shin splints, I might do some like periosteal pecking. This might be the one place where I might do some of that. I don't think you're gonna stimulate bone healing or anything like that, but I might just go full depth and hit that a little bit. We have our peroneals on the side over here. And I would say, since this side of the leg, this is so safe, especially with fibula as the backdrop. So if you want to hit peroneals, I don't care which one. Usually in athletes, like basketball players and athletes, usually there's going to be some hypertonicity in this, like there's one right there, like lateral leg. So if you find hypertonicity, you can tease out which muscle it is. I don't care. Like needle the trigger points and move on, right? That's kind of the take home. I'm not saying it's not scientific and stuff like that, but he's tight in that guy. If we come behind that, push down into my hand. Okay, so there's some gastroc and some soleus. Okay, we're not going to hit those from this angle, but just so you know where they are. Okay. Sometimes you get a posterior tibialis tendonitis, like a real one. Okay, that's not masquerading as something else. To hit that, a patient will actually be prone, but posterior tib, just so you guys know, right, is there. We just are gonna wanna hit it from behind. I'll show you guys that in a little bit. So how's about, so we got quads, 1, 2, 3, easy. Where's the other quad? Oh yeah, it's underneath here and there, okay? So quads, 1, 2, 3. You guys can do needle in, needle out for anterior tib all day, safe. You can smush it down onto the tibia, and I would just needle kind of medially, maybe like medial posterior, let's say 45 degrees. Okay, and then all along fibula, you can needle just perpendicular, or anywhere you want to, okay? Anywhere you want to in there. And that's gonna be all that we're going to needle in this position. I do want to show you guys posterior tib in a minute. We're going to tip our hat to needling like chronic Achilles, heel, and plantar fasciopathy pain. I never do it. I lie. I have chronic insertional Achilles tendinopathy. There's been a few times where I have gone in and pecked around a little bit. But yeah, so at least you guys will get the practice. Comfortable with this?
Yep.
Okay. Ideally, don't spend time drawing, right? You won't be drawing in the clinic. If you can do it without drawing, that's better. If there's something that you want to draw or want eyes on, make sure and let me know, okay?
Okay, so you can stay there.